Okay, now we have an order to discontinue the NG tube. And to discontinue the NG tube, I need my catheter, 60 milliliter catheter tip syringe, and I need a tissue for the patient, and then some type of drape to cover the patient in case any secretions come out. I need to turn off my suction if they're hooked up to suction as well, and disconnect that. So I have checked and verified my order. I've had my equipment ready. I've identified my patient with my 2 identifiers. And I want to auscultate the bowel sounds again, and I've done that. And then the next thing I want to do is to explain the procedure. So, Mrs. Olson, I am going to discontinue your NG tube. I'm going to pull it out. And I can tell you this is not going to be near as uncomfortable as it was as putting down the NG tube. It will be a little uncomfortable, but it will only take a few seconds to get the tube out. I'm going to provide for privacy. I'm going to do my hand hygiene, and I'm going to put on my gloves. I got the bed at a good working height. I've got the patient in a high Fowler's position. And I've gave my patient her facial tissues and got the emesis basin, because again, you just never know when you initiate that gag reflex. You never know when they could gag and vomit. I turned off my suction, disconnected it, and now the next thing I need to do is to insert 20 milliliters, 20 to 30 milliliters of air into my tube, my nasogastric tube. And what that's going to do is that's going to clear any secretions out of that tube, so that as I pull that tube out, there won't be any secretions to leak down and for her to aspirate on those secretions. So, but in addition to clearing the secretions out, again, I'm also going to clamp and hold the kink, I should say, the tubing. And again, that will also help prevent any aspiration of contents. And here we go. Okay, I want you to take a deep breath, and I want you to hold it. Okay, and it is out. I pulled it out smoothly and steadily, and I had the towel in my hand to grab the tube to collect any of the secretions that might be on the end. I've inspected the end of the tube to make sure that it's intact. And I'm going to measure any amount of drainage and note the character of that content and dispose of the tube and drainage equipment into the proper containers according to the policies of the facility. I'm going to clean her nares real good, and I'm going to provide mouth care as needed. Then I'm going to document that I've removed the tube was intact, amount of drainage and character of the secretions, and how the patient tolerated the procedure. And that is all there is to discontinuing an NG tube, with the music in the background.